This is our great opportunity of working with many troubled young people who come from a great deal of abuse, and an orphanage is a place for them to find love and caring. It's sometimes a place, a haven, a sanctuary for those that if they leave here will be killed as other family members have been. Truly needy kids with emotional issues, and having students from Francisca Markham University, having 2 psychologists here who are great learners, helps us to do many neat things to relieve the traumas, the depressions, the fears of these young people. It's been a really busy, sometimes challenging day, but with a lot of good feeling, a lot of success. And I anticipate we will continue to do so, and hopefully over the years we can develop closer relationships, bringing more and more students in to take the place of other psychologists as time goes on, doing a wonderful thing in the area of treating traumas that have been so difficult to treat in the past.
Also, there's 2 siblings living here already, and the mother is like mentally ill, so she just keeps having kids. And she's an addict.
And do any of the children have some brain damage, like alcohol syndrome?
Mental, así como retraso, no, pero las actitudes, o sea, si son disociales, daño físico, biológico, no. Abraham que tiene mutación en la oreja.
No, pero Viviana, la que va a entrar ahora.
Ella solo
¿Y algún comportamiento?
Conductas disociales, pero así como que...
Yes, fluctuation in mood.
Yeah, mood swings.
Okay, we will begin. No evidence of sexual abuse.
No.
But she scored pretty high. See. Our students here in the university. Yeah. We have our translator. She's helping me with some of my protocol that is in Espanol, but it's Mexican wording, and so we're putting it in Guatemala wording, and so, but we're almost there.
Almost. Yeah.
What I want to do today to kind of help you all prepare for it, as you listen to tough things like this, you want to have heart and spirit with it, but you don't want it to stay in your soul. And so, what I think is kind of a technique is some of the energy psychology, it's the same stuff, okay? So if you can kind of free your hands a little bit, and you can touch up on the upper part of your chest. These are the neuroleptic pathways. If you press hard, you'll say, well, that's kind of sore. The reason it's sore is there's a lot of toxins in our body that go here in this place. Now, what we're doing, there's many, many techniques to get people set up for energy psychology. Think of a battery that you have a little radio, and you put the battery in, but you put it in backwards. Is the radio going to run? It's not. Energy psychology is not going to work unless you put the batteries in right. Okay? This is my best way to do it. Okay? So take a nice deep breath of air. Notice, see, profundo, notice, exhale from the boca. So you're always breathing in deep and out, letting go of stuff. And kind of, I'm going to say something and then I'd like you to kind of repeat it, if you would. Even though I know I will hear some difficult things today, I will be able to be helpful and supportive. I will continue to love and accept myself. Even though there may be some very sad, traumatic things that I hear, I will be able to remain connected with the patient. And I still will be safe within myself. Take a nice deep breath here. And now on the top of your head, 2 fingers. This is the crown chakra. As you're tapping in, you bring in your highest spirituality. All the deep spiritual parts of our life are being. The second chakra is the third eye, which is our intellect. Today we are opening our minds to new learnings, new understandings. And we will find creative ways to help our patients. Tap on your eyebrow, breathe in deep, exhale. Releasing any feelings of embarrassment. Tap on the side of your eye, right on the bone. This is the gallbladder meridian. This is the rage, anger meridian. You'll see this used a lot today. Asking people to think of their anger and their trauma. But just think of any frustrations you have. You can use 2 hands if you want to. Just release that. Underneath your eye, very powerful bladder meridian. This is where anxiety often grows. But if we rub like this or tap, you will reduce your anxiety. It will begin to go away. You'll feel more and more relaxed. Nice deep breath there. Under the nose, balances your system to the tailbone, going over your head, under your lip. Connects going the lower part of your body. Collarbone, tapping into the fears, any fears that are there, releasing any of those, any phobia thoughts. Under your arms, balancing your hormonal system. Nice deep breath here. Karate chop, balancing your cardiovascular. And fourth, cinco, cuatro, 4th, 5th finger. Place your hands on the side of your head and take away from you anything that's in your way of learning. And pull up the protective, kind of think of a plexiglass window that protects from evil and danger. Place your hand horizontally on your heart. Feel all the people in your life that love you. This is the last chakra that we will use today. It's the heart chakra. It's the most important chakra. This is what's missing. The heart chakra is a place that the patients will return to when they begin to lose something. When they begin to feel fearful. Very, very powerful. And in your life, you think of all the people that love you and all the people you love. They're powerful. And it's very important for you to love the people we will work with today. You transmit love and care. Now, the individuals that be coming in, we have a pre and post test. Has the testing been out? Try to get.
Todavía no han hecho el test, ¿cierto? No, todavía no.
No han hecho nada, pero ella Dianita ya la habíamos.
But at COVID working with another girl first, and she's done.
See, correct. And then I'll ask one of the 3 students if you all would do a pre-test, okay? And then later on today, after lunch, there's the second page of that, which is a different color. Pre-test, and here's the post-test. This green, it says post-test. So what we want to do is get a measurement. And this would be a very good thing to cover. Last night when I met with Dr. Devasa, she said that the university will work with us, and she'll send one of the university members to pick up the test like a week from now, like we do a 1-week test, see? And then it'll be just a 6-month test and a 1 year. And she's going to do all the statistics for us, for the study with me. Okay? So that's going to be nice for us to have, okay? That's going to be a good thing to do. What I would ask you all to do, if you would be to make a copy for myself, okay? I'm happy to give to come back with something. We want to figure that out. And I might be coming back in the fall, do some things at the university. We don't know yet. That's kind of, it will be negotiated, and then you all might be able to be part of that too. And that might be kind of interesting. But they work here full time sometimes. So I think that would be interesting. Okay. Great. And I think you have Dr. DeBoss's phone number or email. And she said she would send her driver. I'm just thinking about something that maybe by the end of the day, before you all leave, if we could copy what we have, and then we could give them the original. I could take one to work with, and she's the one that we're trying to bond some of the staff. See? Are there 2 staff members? See. So I would want them to be kind of part as we're working, so I want her to see that reality. Okay, that'd be great. Okay, super. I think we're in good shape. Our camera person would be here.